to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Pallabi Sanyal-Dey. She is an internal medicine physician. Her Kevin MD article, which we'll talk about today, is titled How AI-Based Technology Can Help Improve Hospital Capacity Management. Pallabi, thank you so much for joining me on the show.
Absolutely. I'm so excited.
Get into the article in a little bit. First off, briefly share your story and journey to where you are today.
I am now in the atypical clinical pathway, another way to continue being a physician. I started this journey a few years back. I've been part of the UCSF system for years and was fortunate enough to go through some lean-based healthcare certification while I was part of the system and got to do a lot of different, Kaizens, process improvement, all that stuff. And I realized through that work, I actually really enjoy working on hospital operations, as challenging as it can be. I think the thing that really fulfilled me in that work is being able to meet folks and staff members in all different areas or sectors of the hospital, whether it's housekeeping, whether it's transport, cafeteria, you name it, all the different people, because there are so many people involved to really deliver good quality care in a hospital. And it really takes all of those folks and to understand their flows and their processes. So anyways, I really enjoyed that aspect of it, getting to connect with all these different folks outside of just my pure medical team of docs and nurses and whatnot. And with that, I started to realize that there are certain things in academics people strive for when they're in that type of realm. And I love teaching and working with medical students and residents. But outside of that, I found that some of the operational process improvement work I would do, my hands were a bit tied because of just the nature of being in certain types of systems. And I could only give so much effort into it. And then I also realized in the long term, I wasn't really focused on how many papers I can get published, what is the academic role that I can achieve, et cetera. And then it made me to think, what am I aiming for? And I realized that some of those opportunities, after a lot of soul searching, working with some coaching, even outside of UCSF, that opportunity lies outside of the traditional hospital setting. So that is when I really embarked on a bit of a career search of what does a physician do if they're into operations and wanting to explore tech and healthcare innovation. There's no map for that. So what it led to was about, 40 plus coffee talks essentially. And this time it was pre-pandemic, meeting with folks even outside of actually coming from UCSF who then branched off to do their own startup companies or work in other realms and other people within my network. Just getting a sense of what are the different ways I could go in my career. And also I worked a little bit on my LinkedIn profile and little things like that. So folks knew I was actually searching, which is also an important thing. And after a long time, it took about 2 years, I would say, of some dedicated time of doing a lot of learning and conversations, cold calling, if you will, through emails and chatting with folks and understanding their journeys, that a recruiter actually reached out to me regarding an opportunity that lived in this hospital clinical operations space. And eventually, long story short, that is what landed me with my current job today, where I literally get to work on how do you improve inpatient flow from outside of the system, leveraging technology and math, but using the experience I've had being on the front lines and actually working with teams to do some of this work. So
now, before getting into your article, how AI-based technology can help improve hospital capacity management, give us a little bit of a kind of a hospital workflow 101. Tell us about some of the biggest obstacles that really impedes patient flow in the hospital before getting into your article.
So some of the biggest things with hospital flow is, at the end of the day, a good flow model is a model in which a hospital is constantly able to provide access to care for any patient who arrives either through their ED, from the OR, from an outside clinic. The moment they need to go into your hospital and get and receive inpatient care, it happens. There is no backup. There is no ED boarding. There is none of this nonsense, or you don't need to get transferred to another facility. Now, there's a lot of elements to that throughput piece that make it challenging because of inefficiencies that are unfortunately inherent in the system And it is a little bit of the Swiss cheese model where it's not just on one party. It's several elements that need to be in synergy to make those inefficiencies go away, but that is hard work. And we have imperfect systems, whether it's the EMR, whether it's the manual processes a lot of our admin have to use in the hospital, whether it's literally just staffing, which is the biggest issue right now across the nation, of not having enough folks to even staff and really meet the demand inside hospitals. And the bottlenecks inside a hospital when it comes to flow, first off, obviously, everyone knows often happens in the ED, right, where the gatekeepers are. And the worst case scenario there is either the hospital, God forbid, goes on something called diversion and they have to tell the ambulances to route to other hospitals, hopefully within their network or other places. The second thing that obviously happens more often than not is patients do end up getting admitted, but they're sitting in the ED, which is not an ideal environment for them to receive their inpatient care. Lots of studies have shown what those outcomes can be when they're racking up minutes to hours to even sometimes days in the ED. And then when they finally get into the hospital, they're not necessarily on the right floor for their particular service that they have been admitted to. Or by the time they get there, hospital day 2, 3 has started. And then the care that they receive during their inpatient stay, there's inefficiencies there. Like I said, whether usually due to often staffing and some other processes and waste that are built in. When you can get that MRI, when you can get the EGD, it's the weekend. So XYZ doesn't happen, even though it's a hospital and patients are coming in sick throughout the week, no matter what time it is. So a lot of that inpatient care often serves as a barrier even to get things done, whether it's a medical sort of intervention. And then there's a lot of non-medical issues that again rely on other teams to be able to provide or deliver, whether it's a PT consult, speech, OT, case management, being able to communicate with the insurance provider. And then it comes a little bit more towards the end of the stay, where again, your ancillaries such as case management, they can do the best thing that they can do. But if your skilled nursing facility doesn't have a bed, guess what? The patients can be waiting inside the hospital until they actually have that bed. And no matter how hard the hospital works, they can't necessarily change that story. So anyways, that's just a quick summary of some of the bottlenecks that happen, but hopefully that gives a little bit of that sense. And the other thing, we're great in hospitals at reacting to fires, right? Yeah. Whether it's both clinical, whether it's our codes, et cetera, we are wonderful at working miracles when fires occur. We are reactive. The thing that's hard to do in hospitals, given the resources we have and the efficiency issues I talked about, is to be proactive. Also because of the tools we use. They are quite outdated compared to other industries, even though we're much more tech savvy than we used to be when I first started training. And because of even that aspect of it, we're not used to actually utilizing or leveraging technology at its finest, because we often don't even have access to it. And often it serves as a barrier. So anyways, changing from the reactive to the proactive state, I think is where that sweet spot will lie, where it can positively impact flow for us. And that is the arena in which I work in, and which I help to work with healthcare systems to utilize that. How do you use a tool of that nature and really impact flow positively?
Yeah, so you talk more about that in your Kevin MD article. AI-based technology can help improve hospital capacity management. So talk a little bit about that article for those that didn't get a chance to read it.
Sure. I switched careers a few years back, and this was my first foray into really being exposed into what even AI means or machine learning. Sure. Granted, my partner's actually in that whole realm, but it's a very different thing to actually be working directly with folks who literally are creating a tool to help the system that I've always been a part of. And what I learned along the way is that there is so much to be learned from the fact that what patterns actually do exist in the way we provide care and in the types of patients we see on a day-to-day in the hospital. And the data scientists, the best engineers within this area, they are able to pick up on these patterns through the technology that they have built. And in the company that I work in, our particular arena is that of machine learning models, where they both utilize there's always historical data, but even more relevant is the real-time current, what's going on in the hospital right now, and a whole host of variables that describe different units in the hospital, the patient population in the hospital, and also the providers on that floor, whether it's nursing, physicians, ancillary, you name it. And these models that the data scientists are able to create and design can actually help to reflect, I can tell you with great accuracy what's going to happen hours from now, whether it's from a bed balance standpoint, whether it's from an admissions and a discharge standpoint. I no longer have to constantly rely on the human, on the nurse, on the physician to constantly showcase, hey, I think this patient's going to be discharged X hours from now, X days from now, because we are also running around doing so much other work that is often the last thing that we end up doing. So what I came to appreciate is when you do leverage technology like this, it actually can do a lot of that work for you to provide an accurate forecast. And then when you have the ability to really utilize solid forecasting that is actually reflecting what is going to happen in the future, folks like me and you working in the hospitals and our staff, they can trust what these machine learning models are forecasting. And then the beauty happens, because then you get to ask, if I know XYZ is going to happen hours from now, what can I do right now to prevent that bottleneck from happening? And that is what I discuss about the specifics regarding some of those operational decisions you can actively, effectively make if you have technology like this in your hand that showcases hour by hour, even a day, 2 days, 3 days out from now, what's going to happen from a flow standpoint. You can actually start to etch away at a lot of those throughput time-based metrics that affect things that our C-suite and healthcare systems have to care about, like length of stay, things of that nature, which unfortunately, at the end of the day, it is a thing that folks need to pay attention to. And the last thing you want, which happened during the pandemic, is you can't even do any of your surgeries, which is like the financial backbone of a lot of healthcare systems. Or if you even could, you don't have any beds because more than half those beds are taken up by COVID patients. So how do you utilize and leverage the tech we have to make sure you will always have that bed available for when the OR patient needs it, from the PACU, et cetera, from the ED, from the clinics? And that is what I get into in the article, the different facets of that, what kind of operational decisions you can make, whether it is discharge focused, even knowing which units in your hospital are going to be in the biggest demand later on in the day. Those are actually the discharges you should be focusing on the most to make sure they happen, versus telling everyone work harder, work faster, which is unfortunately a lot of the messaging that happens right now.
So give us a scenario, maybe a before and after, that really contrasts how AI leveraged technology can improve workflow. So it could be a hypothetical scenario, but give us a before and after picture of what your technology would change.
One example is when staff and leaders come to meet in a hospital when it comes to flow. They do it in a variety of ways, whether it's huddles, bed meetings, things of that nature. Now, traditionally, if you do not have our tool, what usually happens in those settings is people go through somewhat of a roll call situation, which is actually an improvement from the past, where they just call out numbers such as, these are the patients we have on this unit today. I think X patients are going to leave. I think Y patients are going to come in, maybe 2 from the ED, 3 from the OR, things of that nature. So it's a little bit of educated guessing and a little bit of known, because they spoke with the PACU, they spoke with the ED, and they know that these patients are coming in. And that's where it ends. And then they go unit by unit. And the resources throughout the day, your hospital admin, also go unit by unit, checking in with everyone, and then reacting to fires that happen where the flow occurs. It is a current situation that gets outdated very quickly because numbers are constantly changing. And what is lacking in that scenario is a strategic focus, because there's truly no forecasting that is being used of what is going to happen in the future. It's all about just now and already what happened in the past. So what happens when people use technology such as ours, such as IQ for inpatient beds, is the conversation literally changes overnight from the reactive, rote unit by unit, checking off the list and answering pages, to I know we're just going to talk about these areas of the hospital because I know 7 a.m. tomorrow, or I know 7 p.m. tomorrow, this is going to happen. They're going to run out of beds. So what do we do right now to improve our bed availability, to improve that discharge outflow, to improve that throughput so that they can actually meet their demand? Let's talk about that versus everyone just rote calling out, doing their check-ins of their numbers, and really no problem solving if of a proactive fashion is happening in those meetings. It's a situational awareness that's happening, but that's the extent and putting out fires. So we change it with a bit of a more proactive focus.
We're talking to Pallabi Sanyal-Dey. She's an internal medicine physician. We're talking about her Kevin MD article titled How AI-Based Technology Can Help Improve Hospital Capacity Management. Pallabi, what are some of your take-home messages that you want to leave with the Kevin MD audience?
There is a lot of opportunity using certain tools, like certain things within tech, whether it's machine learning, AI, whatever you call it. There is actually stuff out there that can help support us in our day-to-day that actually will not be the barrier to our work, but can actually elevate our flow work and make us do work in a smarter, more strategic fashion. And we do not have to rely on our constant workarounds, our educated guessing, etc. We actually have tools that can help us in this arena. And if you choose the right tool, it can change the way you do hospital operations. And at the end of the day, it literally can change and improve your ability to provide increased access to care in your hospitals. I want to shed some light and provide some hope in that arena. And there's even some newer things we're working on, such as being able to do natural language processing for whatever is being entered into the EMR, so we can signal to our staff what they can work on when they start the day without having to wait for rounds, wait for calling, going into the chart, things of that nature. So the frontliners are always not carrying the burden to have to message, to have to tell the story. So my kind of main message there is, please do explore these fields. There is some incredible innovation going on. Of course, I'm excited about what we're doing with IQ over at LeanTask because we've been able to see some amazing results across a lot of healthcare systems. So I encourage folks to explore that and that we have the conversation and know that things can actually be better. It doesn't have to be the way it is in current state. And we don't have the luxury of waiting either. Given what we've seen in the pandemic, flow has always been an issue. It just got spotlighted during the pandemic. This issue is here to stay. So yeah, so get out there, contact folks like me, explore what's out there. There's a lot to be used and that can usually actually help make the staff experience also and that of the patient experience better. So
Pallabi, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you.